Welcome, everyone. Good evening and good afternoon. My name is Father Demetrios.Kazakis. I have the honor this evening of being with 5 doctors and very well-respected people within our community of St. Nicholas in West Babylon, New York, who are doctors of various practices and who have had a lot of exposure, unfortunately, to the coronavirus. I asked them with me this evening to discuss the coronavirus and how their faith has been strengthened or how their prayer life has been challenged in all their experiences with COVID-19. We're going to have a brief discussion this evening on some of their experiences, some of the stories that they've had in their practice, and how they are able to call on our Lord and Savior Jesus Christ for prayer and for help and for strength. So thank you for joining us. To begin with, Dr. Mary Camilleras, who is a family practice doctor, family medicine in Lindenhurst, New York. Dr. Sophia Stergakos. Actually, Dr. Mary, you want to just wave at the camera so we know who you are? Thank you, Dr. Mary. Dr. Sophia Stergakos and Dr. Martha Boulukos. Tsarkalis, sorry.
Tsarkalis.
I'm going back to your maiden name.
That's okay. I was
Dr.
Boulukos.
Stergakos. Dr. Sophia, can you please wave at the camera? Thank you. And Dr. Martha. There's Dr. Martha. Dr. Penny Patsis works in psychiatry within Lindenhurst. Thank you, Dr. Penny. And Dr. Lavanda Manusos, Dr. Katherine Mathews, as many people know her, is a pediatrician in Lindenhurst. So thank you all for joining us, and thank you for your input this evening and all the work that you do in our community, not only serving our church, as many people do, but you specifically are helping many people. You are literally saving lives as first responders, as doctors, and within your own practices, you are truly making a difference within our community. So we thank you for your sacrifices and for your dedication. And good evening to you all. Thank you. I hope everyone is well. Are you all healthy physically? Have you experienced any sicknesses or illnesses? Dr.
No.
Mary?
We're fine, thank you. We're good.
Very good. Everyone's healthy, everyone's well?
Healthy, no symptoms, nothing.
Thank God. Dr.
Nothing.
Labanda, everyone's healthy?
Everyone's healthy. Everybody's
Great.
healthy.
Thank God. Who would anyone like to reflect just basically on, I don't want to focus on anything too negative, but the reality of our lives right now is that coronavirus is something that we've all been greatly affected by. And this is, I would say, the most serious thing that has happened in all of our lives. Is that a safe statement?
Yes,
Dr.
absolutely.
Penny, Dr. Penny, would you like to reflect a little bit on the seriousness of COVID-19?
Well, from a mental health perspective, of course, it's a monstrous from the medical perspective, but even from the mental health perspective, it has created in all people such fear and anxiety because of the complete upheaval of everyone's life. Every aspect of our life has been it has been changed. And people are very, very anxious, fearful. It causes depression, and I'm definitely seeing a lot of that. A tremendous amount of worry because of course, every aspect of our life, financially, educationally. As I said, every single aspect.
Dr. Mary, because we had this brief discussion again during parish council about maybe 2 weeks ago. What scares you the most about coronavirus?
What scares me the most is the non-compliance of people. We're dealing with a horrible disease, a virus that we do know, like initially they said, well, this virus doesn't walk and it doesn't fly. And for it to enter our body, it either somebody has to be closer to us than 6 feet, or we have to be careless and let it enter our body through our nose or mouth. So everybody's very diligent, I think, with washing their hands. But I think people not caring about social distancing, not wearing their masks, is going to prolong this. And I'm scared we're going to lose many more lives unnecessarily. We don't have a cure. We don't have a treatment. It's a virus. We do know viruses need our bodies to survive. And if people don't take this seriously, and if they don't believe it, we have to make people that don't believe it. And I think we're facing a very grim future. And that frightens me greatly.
There's a lot of elements, obviously. It's one thing to be scared of the virus. It's another thing to be scared of how people react to it.
We know that when people run or jog because they're breathing heavily, if they, of course, they're jogging, so they're asymptomatic, but they can have the virus. And that's why, especially when you're jogging, protect the other person. Either wear your mask. I know it's not easy, or at least distance yourself. This young woman just kept on jogging and jogged by us so closely. It was so upsetting because she was protecting herself. She was out jogging, but we don't know if she was infecting us. And that's what's happening in the community on a whole.
Right. I think we've all seen that. And I think initially we didn't worry so much about wearing masks and we were just keeping our distance. Now, I think a lot of people are wearing masks, but I think that people are still not taking this as seriously as they should. And now recently, Dr. Lavanda, all of a sudden, while we're speaking about going back to school as soon as possible, there's a new sort of revelation that COVID-19 in some capacity is affecting children and then giving them there's other side effects to this. Can you explain that a little bit?
It's mimicking Kawasaki's disease, and Kawasaki's disease is the symptoms of Kawasaki have been around us for forever. And I admit, I see one Kawasaki every year to year and a half, and it's mimicking Kawasaki disease. And by that, I mean, when I suspect a Kawasaki disease or Kawasaki-like disease, they don't just get admitted, they're not observed by me. They go straight to the intensive care because it's fast and furious. It's like a meningitis almost. It's fast and furious. The quicker you act, the more lives are saved. And even if they're in the intensive care, does not mean that those children will make it. Typically, you see it, Kawasaki, you see under the age of 5. I've had a true Kawasaki. The last one I had admitted was 9. So, you have parameters of age groups, but, viruses don't always follow the rules. You'll see them in all different shapes and sizes. You'll see something that the last thing in your mind as a diagnosis of a Kawasaki or any other disease, and all of a sudden that's what it is, even though it was on your last of your differential diagnosis. It's not the number one thing you suspected. Still is the youngest one in Suffolk County was my patient.
How old?
17 months.
Unbelievable. 17
months. So when I admitted, I did not think this was coronavirus because of the age.
Wow.
So still the Board of Health is checking up with the mother. I spoke to her the other day, weekly, because it's a learning curve.
Of course.
So as a learning curve, the Board of Health is following up on every little aspect of the child's life to learn for other cases in the future. And I didn't think it was coronavirus when I admitted. I thought it was respiratory distress. But that child had all the clinical signs of the regular COVID disease that an adult has. It was fast and furious. I had spoken with the mother at 10 o'clock in the morning because the baby just felt warm, was eating fine, was playful. And by 4 o'clock, the baby was breathing at 70. I clocked it at 70 a minute. The respirations were, you try breathing 70 breaths a minute. You can't take oxygen in. You can't feed. And we really thought we were going to go into the ICU. But just as fast as that, as the symptoms came, fast and furious, with that child, they left. Next morning, the baby did great. She was actually discharged. Instead of going to the ICU, she was discharged within 26 hours.
Yeah, thank God. Thank God.
And 4 days later, we found out it was COVID.
Wow.
And that being said, everyone taking care of the baby, no one was wearing masks, nobody had protective gear. It was the time that the hospitals were craving for protective equipment, and they still haven't gotten them.
Right.
They still don't have them. They wear regular masks unless they're treating a COVID patient on the floor. But you don't know who is going to have positive COVID symptoms in a day or two.
Mm-hmm. Right.
So you could test negative that day and still be harboring the disease.
Right. Right. Dr. Sophia, you're spending a lot of time on call. Can you explain a little bit about, you were telling me when someone calls 911, they're immediately directed to you. Can you tell some of your experiences with that?
Sure. So my sister and I belong to the Independent Physicians Association. Mm-hmm. It's a private group on Long Island for independent practices. And they just recruited a group of doctors to help out and assist for 911, 311 calls. And basically, when they dial 911, they're directed to us with their symptoms, and it includes Manhattan, Brooklyn, Queens area. And I've been helping out over the weekend. It was tragic. My experience was very intense. Over the past month, I've learned a lot. The problem with this disease, like we said, is the uncertainty of the disease, and how we have to just think very quickly and help these people. And when someone's on the other line and they can't breathe, and you just learn that how their breathing pattern just follows a certain characteristic sound, and I'm sure everyone could hear it, all of us could. And when they're telling you, "Doctor, please help me," I feel like I'm swallowing glass. It's just very serious.
Do you see those symptoms most often, or are there other confusing elements to these conversations that you can't quickly diagnose?
The majority of the symptoms are dyspnea, fever, chills, shortness of, it's basically, they call because they're short of breath, and we have to dial 911 immediately. But it's just the psychological aspect, the way they feel, the fear.
Dr. Martha,
Yeah.
You're receiving calls too that are directly for 911, right?
And we're receiving also from the practice endlessly.
What do you think? How does the average conversation go with someone who calls that they think that they have coronavirus, and how quickly are you diagnosing these patients?
I will tell you that the calls have changed over the last 6 weeks. So in the beginning, it was flight or fight. Everybody was like, "Oh, I just have the flu. I don't have COVID. I have a fever. I'm telling you, I don't have COVID too." Now it's, "Help me, I have COVID. I know I have it." So the dynamic has absolutely changed in the last 6 weeks. There's still people in denial that think it's the flu, but the majority are more adherent now. But the unknown and the scary part is that they could just say, "I have chest pain," and then they're in the hospital within 48 hours, and they're 31-year-olds, they're 40-year-olds. I have more patients in their 30s in the hospital than I do in their 60s, 70s, or 80s.
Can you say that again, just so that we can hear it?
Yep.
Like 1,000%. Go ahead.
Yes, that I have more patients in the hospital. You can hear me?
I can hear you. I'm trying to prove
that are 30s. I have patients with blue toes. I have patients with pneumonia within 48 hours. I have them in the hospital at Stony Brook for 3 weeks who are now calling me today. I have 3 this week that are brand new, that are double pneumonia. One of them, chest x-ray was negative, did CAT scan, ground glass appearance, been to the pulmonologist, and now they're diagnosing her with COVID.
Right.
So it's any range of age groups, and that's what people, they think it's the flu, and you don't have to have only a fever. I mean, I have 3 right now. One that's a 48-year-old who's my age. I have a 31-year-old. I have a newly diagnosed police officer, and he's 37, and they're all pneumonia within the last 48 hours.
Okay.
Every single one of them.
And they already had coronavirus?
2 of them have had corona, and now they're coming back.
And now they're coming back with
symptoms. Pneumonia, difficulty in breathing. It's endless. It's
Right.
endless. And it's not the typical flu. That's what I'm trying. But it has changed the dynamic a little bit. They are following. But we still don't have therapeutic options that are fully, they're not out there. We don't know. We're treating unknown. And that's the ultimate message we have to get out there.
Right.
And it's scary. And people have been on ventilators and they've survived.
Right.
But people have to understand that this is not a joke. And I just wish more primaries would get out there and say, hey, on the news, this is what we're dealing with every day.
It was something that you were saying, before you disappeared. You're on call. I have to say, you had to take a phone call just now. You had to leave us and you came back. But what do you think is the most challenging thing with this learning curve on trying to diagnose people and look at these symptoms of coronavirus?
Well, we're learning things every day. It is the unknown enemy. And what we're left with is just throwing weapons at this monstrous disease that we have no clue of treating. Every day, every week, we read about new clinical trials. We read about new tests. We read about new antibody tests that work, that don't work, medications that have failed, then they work again, side effects and whatnot.
Yeah.
We're learning every day that this disease is bothering every system in our body, from not just our lungs, but our cardiovascular system. It's even presenting as stroke in patients. And now we're learning how people develop blood clots throughout their body. It's a very devastating disease.
Right. All these things that we're dealing with, especially the unknown, all of us from our non-medical perspective we're trying to understand all of this. We're trying to make sense. I'm going to go to Dr. Penny now, because I think a lot of people are, and you had touched upon this already. I don't want to say very simply that people are just going crazy, but we are. I think all of us are just fed up with bad news on the news. I'm very frustrated when we hear of this, discussion of a vaccine that may not come for another 18 months. God knows what this is actually going to mean. But I'd be curious to see what Dr. Penny has to say about our tying in the reality of our life right now, maybe analyzing our own mentality of this, but then, because as a priest, I would say incorporating our faith and incorporating a prayer life. How do you think all of this can tie together?
Oh, I think very, very well, because one of the things that we have known through research that helps people deal with fear, anxiety, is meditation, getting to our thoughts, and because a fear is a thought, getting to our thoughts, and trying to have alternative, more positive thoughts, and not to catastrophize. And unfortunately, in a situation like COVID, it's very difficult for people not to catastrophize. And as you had said previously, people try to put the news on. The news have become overwhelming. They don't know who to trust. They don't know the messages that they're receiving, because this is a situation unlike any other that we've ever faced. And so we're all charting the unknown together. And I think at a time like this, what we have is our religion and our prayer. Prayer is the best form of meditation. Prayer, I believe, gives us hope. And that is what we need. So even though things look very dark and grim, I think when we reach out to God and pray, that gives us solace, that gives us a sense of comfort, and makes us look within, that we are not completely helpless, or hopeless, that, you know, we can do what we can do, and we need to do what we can do. And everyone can do better. We all can do better to make it better. But I believe that prayer, and this is research is in meditation, that it actually, there are areas of our brain that it actual, under an MRI, we actually see a calming response. And prayer is very close to meditation. So I believe that is, when someone says they are religious, I'm comforted by that, because I think that gives us another tool during this time that we can give people, and that people need so desperately. We need something positive to hold on to. We need faith and hope, and to counter our sense of helplessness and isolation. You know, we started out and people were very, very anxiety ridden. Now we're at a phase, I believe it's week 9, that people feel completely isolated,
Right.
and they're feeling dejected and depressed and hopeless.
Right.
So I think during this time, our religion, you know, and our prayer is very, very important.
Dr. Penny had just said that relying on religion and prayer as a tool is a valuable tool, and something that you all as medical professionals, I'm sure you rely on. How often do you catch yourself praying during the day? Maybe you're praying for strength or patience. Maybe you're praying for God's help. Do you find yourself praying often, especially in terms of responding to coronavirus ordeals?
I find myself praying very often, something which, of course, I never did before. Probably because, I guess like all of us, we never had the time. Right now, I'm praying very often. And especially like what the girl said before, when on the other line, you have somebody that's so helpless and suffering, and we have limited means to help them. And you follow them, basically just encouraging them to live and carry on, and then hopefully not be admitted to the hospital. So yeah, you do pray a lot more. I think that this coronavirus is very humbling. I think what happened is prior to this, we live in the United States, in a country that offers us everything. So much that we all, I think, are involved in more inwardly and satisfying our needs, you know, of course, our families and everything, but more materialistic kind of a life. I think this experience is very humbling. It lets you know how we depend on everyone, how important every single person is for us to live. You know, whether it's the farmer, you know, power to all these people, they're so respected. The person who's behind the register, people that are out there and they're being exposed to basically to death, you know, for all they know, that's all they hear. And I think this is a very humbling experience. I think it's brought me back to religion. I'm praying more. I'm finding myself in it. I'm finding how I thought, in a way, I guess maybe it was arrogance, you know, it was my job, my work, my patients, maybe centered, more self-centered, where now I find solace, comfort in God for my patients. I'm asking for help with my patients where I really didn't before. You know, I'd go to my journals or what have you, find an answer, or try to find an answer. So no, definitely God has come into my life. I'm definitely trying to change my ways, and I think it's very comforting. It's the only comfort we have.
I think we're all finding different habits and different routines.
Yes.
I would hope that adding prayer life or reading scripture, or even during the day, if we're formally praying in front of our icona, or we're able to find time to have silence, that's important. But even like while on the phone, I'm sure we're all praying for strength, and we're being able to pray for the patients on the other line. Dr. Sophia, you told me something that I think you just started spontaneously praying the Lord's Prayer with a patient. Can you explain that a little bit?
Sure, that was about a month ago during the 911 call.
Yeah.
She was an elderly woman from Jamaica and had no relatives here in the United States. She was very frightened. And we prayed together, and that gave her a lot of hope.
Do you think that you were strengthened in that moment too, or do you think it was just you trying to help this woman?
Sure, I was trying to help, but of course, God was giving me strength.
Of course.
At that point, I was so emotionally exhausted from the whole experience.
Yeah. Dr. Martha, what do you think is a common emotion that you sort of see within yourself while doing all these phone calls and being with your patients? What's a common emotion that you experience?
That I experience? Well, I have to stay very strong when I'm on the phone calls with them. But then I find myself afterwards that I get very emotional. And then I pray, and then I actually cry. Because I feel that I don't know what else to feel, how much I could pray for these people to not be on a ventilator, or they're gasping for air. And I'm like, what do I do with them? And then I talk to them. I talk to them every day, every morning. And then I cry. That's my emotion. That's my emotion. And I pray. And I find myself believing more than I ever did in my life. Right. Because it just touches me, especially Good Friday, the way we were watching through Facebook in church. I literally cried that whole night. That was my emotion.
I think we all did.
Yeah.
I think we were all.
I said, where are we right now? Where are we? And I'm just thankful that I truly believe, and that I just try to help whatever I can in my life. That's all.
Right. Well, we thank you all collectively for your work and being able to offer so much help to people. But Dr. Lavanda, what's a common method that you're able to maybe refocus yourself and be able to pray and focus on your own spirituality?
A common prayer, I really it's just the Lord's Prayer all the time. Lord's Prayer definitely a million times a day. And I always had asked for, to give me the knowledge, to give me the strength, so I could help my patients and not to make any errors. All the years. And I'd pray to God at least 5 times a day for that. Every break I take, I'd say a prayer. A common prayer now as a different prayer? No, I really haven't fallen down on anyone else. Just say my normal prayers that I usually do, just much more often. Every time I pass my icons, I stop and I say my prayers. And I pass them very frequently during the day when I'm home. Right. When I'm in the office, not so often, but about 5 times a day in the car, after going to hospital, in the elevators, I'm always praying, because you pass all these sick people on your way going to the nursery or on your way going to pediatrics. They've opened up wings that were closed for reconstruction at Good Sam, and now it's packed. Right. So on the ward that you were at with Presbytera, now that's full, and not with maternity. So I just pray constantly. But a different one, no. Focus on the Holy Lands a lot.
I was gonna say earlier, ironically, now the 3 out of 4, we had just gotten back from the Holy Land, and I personally couldn't wait for Holy Week. I couldn't wait for Lent, and I couldn't wait for Holy Week, because just coming back from Jerusalem and being able to experience everything. But ironically, we were all alone, and it was a very different Holy Week for all of us. And even though, which most importantly, we're commemorating and remembering the fact that Christ rose from the dead. And even though a lot of us are surrounded by illness and we're surrounded by death, we are able to focus and remember that Christ lived for us. Christ rose from the dead for us. Have you felt God's presence? Anyone can answer this. Have you felt God's presence at all during this process? Even maybe if it was something negative that turned into something slightly positive. Dr. Mary, can you reflect on that a little bit? You made a face.
Oh, I somehow, I feel it very often.
Yeah.
Very often. Maybe because we're hurting more.
Mm-hmm.
I'm not certain,
Mm-hmm.
but I do feel it. We were talking about the Holy Lands, and whenever I say Christos Anesti, I somehow, even though while I'm saying it, I remember certain parts of the Holy Lands.
Mm-hmm.
My mind goes to the cross or where the ascension was, but as I'm saying it, my mind goes back to the places we were at. And but yes, I feel his presence very often, and I think it's because we need it. We're hurting. We're seeking it,
Mm-hmm.
and definitely feeling it.
Dr. Martha, you weren't with us, but you lived vicariously through your mother.
Yeah.
But what do you think that's something positive that we can get out of this whole experience? Is there anything that we can learn, to literally make lemonade out of lemons that we've been handed? What do you think?
Well, I'll just take from patient experience. They've been sending me cards and letters and emails and thanking me for our journey together of, making through off the ventilator, or they're doing somewhat better. And every letter I read or email is always that I'm a changed person. I think I look at life differently. And I'm just amazed at how humans have changed. And a lot of these people, I've known them at least 10 years or 9 years, how long we've practiced. And it's just amazing to watch how much humans could change into a positive outlook out of this whole situation. So that's what I'm thankful for.
Dr. Penny, what do you think about our ability focusing on, I think spirituality is certainly tied into this, but what do you think is like the gamut of emotion that everyone has to walk through while trying to pray, while trying to remain strong? Because I know people are stopping me on the street, or my neighbors, they know that I'm a priest, or people who are at church, and all of a sudden everybody's calling me Father. They're not just calling me Dimitri anymore. They're asking for prayers, they're asking for blessings. But what do you think is sort of like the process of working through spirituality, working through negativity, trying to find something positive out of all this negativity that we're living?
Well, I think a lot of people are kind of sharing with me that this has given them a time to reflect. And to reflect, as Dr. Mary had said, had reached perhaps a point where we were arrogant as a society, as human beings in general. And I think this has given people a time to reflect, to be home with their families. Even though there's a lot of negativity, there's also something good that has come about, I believe. And in reflecting, I think people are examining themselves and examining our behavior. Where have we been and where are we going? What is our purpose in life? A lot of people are kind of sharing, what is my purpose? What is my purpose in life? And reaching out for religion, and reaching out for God, and reaching out for hope. And when I remember reading Willa Cather, and in that novel, it describes the mother losing her sixth child, and her going to the Bible for strength and courage to continue. And when I was reading it, and it was over a decade ago, I was going, "Oh my gosh, I couldn't relate to that." And I think sometimes a situation like this brings us to a place where we know how hopeless we are in affecting our future in a lot of ways, but we also know that we need to believe in a higher power and to believe that human nature from the beginning, we've always managed to overcome. And we're in 2020, and that's what I keep on telling people. We will overcome. We will overcome this. We will be successful. We have to be very careful. We need to use all our resources. But I believe that, we need to have hope and faith. Very, very important.
Dr. Lavanda, what do you think is just to wrap up pretty soon, because I promised everyone this was going to be, we were going to end in about a 45-minute time period, but what do you think is the best way that we can help everyone around us? How do you think we can provide assistance to those that need it? What do you think we can provide, Dr. Lavanda?
Providing a courage to go on in a normal way, to try alleviate people's fears as much as we could. They're calling me that their parents, the grandparents that they live with, have COVID. Okay. But what am I going to do with my children? Okay. So we have to learn how to live with this disease. Right. So we have to alleviate their fears. For the people that are still healthy, because it is a terrible disease. People are dying by themselves. It is a terrible, terrible thing not to be able to comfort your loved one. And I can't even fathom it with their last minutes on earth. So we have to alleviate people's fears. I think that's the best encouragement we could give them, is just by teaching them, by talking to them, that if they see a rash on their child, doesn't necessarily have to be coronavirus. Or if they're coughing, it could be allergies. It's okay. Your child is okay. You're okay. And I think that's the most important thing we could do for them, because this is going to be around for a while. And we just have to learn to live with it, be smart, take care of ourselves, de-stress as much as we could, look into our faith to get the encouragement that we need, to lift us up a little bit, to help others. Instead of, because of exhaustion setting in, you get tired and your temper could be out of sorts and out of the norm for yourself.
Right.
So I think just to be there for people, to know that you're there. If you need me, just give me a call. Right. To encourage them. I think that's the best thing we could do for this.
Right. On behalf of our entire community, I don't know how many times I can say it, because I am going to keep on saying it. We're praying for all of you. We're praying for your families. We thank you all from the bottom of our hearts, because you're all putting yourselves on the line, whether it's in your office or sometimes in the hospital. Your children, for those who are parents, are in the medical field as well. Your mother is Dr. Martha as your receptionist. So the entire family is certainly involved in this, and we thank you. And we are praying for all of you, that our Lord and God protects you, that Panagia always prays for you, and that the holy mercenaries, Nargiri, Ayos Kuzmas and Damianos, that they are guiding you and protecting you. Ayos Pandeleimon, Ayos Nectarios. We saw at the beginning of coronavirus, Ayos Nikiforos, Saint Nikiforos the leper, that he had revealed himself to many people in Greece, in Bulgaria, and Romania, that through his prayers and intercessions, everyone would be protected. So I thank you all for your time this evening. And I'm going to call her right now, but Dr. Sophia, who's on call, and was in and out of this conversation. But thank you for your time, and thank you for your expertise. Thank you for all the work that you do. We truly cherish all of you. And we thank you for everything. And this went very well. We're probably going to do this again, and maybe we'll find a more specific topic if you're willing to discuss
whatever
something
you
more
like.
specific. Thank you. All right.
We do this all day.
I know, and I don't want to. That's what I mean. I don't want to take you.
I have just
want-
laryngitis from talking all day.
You
That's
sound
all.
fine. You sound fine, but I don't. That's what I mean. We really appreciate it because this is stuff that you do all day, and I don't want to make you too tired. But it's enlightening and it's helpful to all of us. You continually give us strength. So thank you so much, and God bless you and always protect you.
Thank you for everything you do.
That's
Thank
my
you for all
pleasure.
you
My
do.
pleasure.
Exactly.
Anna. Thank you.
It's a collective effort.
Oh, of course, of course. All right. God bless you all.
Bye. Bye, everyone.